Hard to believe it is June already, but it is. And June, by the way, is Men's Health Awareness Month. Really a time to draw attention to the healthcare needs of our fellas and to hopefully encourage them to focus on healthy habits and lifestyle changes and even being advocates for themselves to ensure that they live a long and healthy life. I want you to check out a pretty startling statistic. A whopping 60% of men say they never go to the doctor. Why is that? How can we change it? Joining me now to discuss is Dr. Hector Castillo. He is in family practice at Dignity Health here in California. Dr. Castillo, thank you so much. And I'm so glad that we got a male doctor to talk about this, because it would feel a little disingenuous for me, who is usually nagging the men in my family to go to the doctor, to talk to someone who didn't have a dog in this fight. Does this bear out to what you're seeing? Do you find that men hesitate in terms of seeking medical care?
Unfortunately, yes. You do see that pretty common, that my fellow colleagues don't want to come in and just don't want to be checked. But I certainly would like to start off with a very important point, which is prevention is key.
Right.
And prevention does not come without action.
Well, that's the point, right? The fact is, I was about to ask you, what are sort of the big health concerns that are at the top for men? What are the big issues that men are facing? Break those down for us.
Absolutely. According to the CDC, the top causes of death among adult men in the U.S. include, number 1, heart disease, number 2, cancer, number 3, unintentional injuries, number 4, chronic lower respiratory disease, and number 5, strokes.
And when you talk about all of those, let's talk about prevention. They're key to all of them. We know that with cancer and heart disease, early intervention can be the difference between costing your life or saving your life.
Absolutely. Simply put, a lot of these conditions are a direct result of our lifestyle choices. And simply put, our lifestyle choices are killing us. We'll start off with smoking, for instance. If you smoke, do whatever you can to stop smoking. This is one of the biggest changes that you can do to really help you with extending your life and with preventing not only heart disease, lung cancer, chronic lower respiratory disease, and even stroke. So if you smoke, please do what you can to stop smoking.
If there's one thing you can do today, right, that you are in control of, let me ask you, you talk to these fellas. You're one of them. You hang out at the gym, you barbecue with them, you go do a round of golf. These are your peers. What is it that you understand that is preventing men from seeking help? Help me as a woman to understand this.
Sure. I think a lot of it is fear of knowing what could be wrong. And unfortunately, that is what gets you into trouble. Some men present to the doctor when it's really too late. And when that happens, now you're trying to catch up with a condition that could have been addressed years ago.
Yeah.
That could have been caught early, and there would have been treatments in some cases, and someone's life could have been saved. We tend to really focus in on being providers and helping our families, but sometimes we put our own needs aside, and that's something that really needs to change.
It really needs to. How do you think we go about changing it? To me, Marie and I were having this conversation in the break. We think that the younger generation, they're a bit better at that. But, the dudes have a little age on them. People of my generation and older and even just a little bit younger. How do we reach them, Doc?
Yeah. So it really, again, it comes down to committing to making lifestyle changes. So again, don't smoke, eat healthy, have your veggies, your fruits, your whole grains. Make sure that you're avoiding, the fast food on the way home, avoid the processed sugars. All those things will cause heart disease, stroke, can cause cancer. Make sure you're getting out and doing your exercise, whether it's a small walk, a run, going to the gym, all those things will make such a big difference in avoiding these major diseases that can cause you to pass.
And look, if you've
suffer.
let it go for a long time, you can start small. You can start slowly and make these incremental changes so that their lifestyle changes, right? And maybe even just coming in to see somebody like you, a friendly face, as a baseline so that you know what general health looks like in that person. So over time, if you see little changes, that's when you can start to intervene with them.
Absolutely. It has to start somewhere. And I always tell my patients, look, commit to it. It's hard to get the tire rolling, but once you got it rolling, it's easy to maintain it.
Exactly.
That's right. Yep.
Dr. Hector Castillo, happy Men's Health Awareness Month. Thanks for being here to talk to our fellas. We do this all with love. We need you. We need you so much. We love you and want you to be around for a long time in good health.
Thank you, Mikkel.
Thank you so much. Stay well, Dr. Hector.